All right, today we are diving deep into one of the absolute workhorses of your arm, the median nerve. The best way to think about it is like the main data cable, a kind of biological superhighway that's responsible for both the power and the feeling in your hand. Have you ever really stopped to think about what's going on behind the scenes when you grip your coffee, feel the keys on your keyboard, or just, type out a quick text? A huge part of the answer lies with this one single amazing nerve that we're going to follow all the way from its beginning right down to your fingertips. So let's start where it all begins. To really get a handle on the median nerve's incredible journey, we have to go right back to the source and see where this crucial command line actually comes from.
It all kicks off way up in your shoulder, inside this really complex web of nerves called the brachial plexus. It's here that two big branches, the medial and lateral cords, come together, they fuse, and boom, you have the median nerve. Think of it as the main factory floor where the cable is assembled before it starts its long trip down the arm.
Okay, so now we know where it starts. Let's actually follow its path. We're going to trace this nerve through the arm, almost like we're on a road trip, and see how it navigates around all the muscles and blood vessels to get to the hand.
So the first leg of its journey is through the upper arm, and it's not traveling alone. It runs right next to the brachial artery, which is the arm's main fuel line for blood. They're like two critical pipelines, power and data, running together side by side through your bicep region.
Now, as it crosses your elbow, the nerve takes a sharp dive, going deep between the parts of a muscle that helps you turn your palm down. That's the pronator teres. This spot is a really important junction because it's where the nerve starts to send out its first major off-ramps, sending power to the muscles that let you flex your wrist and fingers. And at last, we get to the final gateway to the hand. To get there, the median nerve has to squeeze through this super tight, really rigid tunnel in the wrist made of bone and ligaments. And this is the famous carpal tunnel. You're going to want to remember this spot. It's a critical choke point, and we'll definitely be coming back to it later. So, we've followed its road. But what's the point? What does this nerve actually do when it gets where it's going? Well, it has two huge and equally important jobs. It provides the power for you to move, and it carries all that sensory information back to your brain. Let's look at these two roles right next to each other. On one side, you've got its motor function, all the muscles it controls, and on the other, its sensory map, the patches of skin it gets feedback from. It's both a power line sending signals out and a high-speed internet cable sending data back in. So let's really break down that motor power. The median nerve is in charge of most of the muscles that let you flex your wrist and fingers, to make a fist. It controls that pronator teres muscle, which lets you turn your palm face down, and this is absolutely crucial, it powers the thinner muscles. That's that meaty part at the base of your thumb that allows you to do that uniquely human thing of touching your thumb to your pinky. It's essential for literally any strong grip or fine pinch. And here's a fantastic bit of trivia for you. There's this tiny little branch of the median nerve in your hand, the one that goes to those key thumb muscles, and it has a nickname, the $1 million nerve. Why? Well, because it's in a surgically nasty spot. If a surgeon accidentally nicks it during an operation, it can cause a major loss of hand function, which, as you can imagine, could lead to a very, very extensive lawsuit. Now, on the sensory side of things, the median nerve is responsible for feeling in some of the most important real estate on your entire hand. It covers the palm side of your thumb, your index finger, your middle finger, and about half of your ring finger. And this isn't random. This is the most critical area for touching and interacting with the world, the part of your hand you use to figure out what an object is just by feeling it.
So we've seen this elegant design and its critical jobs. But what happens when the signal in this data cable gets interrupted or jammed? That's when we start running into some pretty common and painful problems.
And the most common problem, the one you've probably heard of, is carpal tunnel syndrome. This all happens at that choke point we talked about earlier. It's what we call a compression injury, where the median nerve literally gets squeezed as it passes through that narrow tunnel in your wrist.
So, how does this happen? The traffic jam analogy is perfect. Repetitive motions can cause the tendons that share the tunnel with the nerve to swell up. This makes the space inside the tunnel smaller and smaller, squishing the soft nerve against a hard ligament. And the result? The flow of information, those nerve signals, gets blocked. That's what causes all the classic symptoms.
And what would you actually feel? Well, the symptoms are very specific. You get that numbness and tingling, but specifically in the thumb, index, and middle fingers, the exact map of where the nerve goes. The pain can get bad enough to wake you up at night, and if it gets really advanced, you might even notice your hand feels weak or clumsy.
Now, carpal tunnel is by far the most frequent issue, but it's not the only one. It all happens at the wrist. But what if that main data cable gets damaged somewhere else, somewhere further up the line, like near the elbow?
An injury that high up, say at the elbow, causes a totally different and very distinct sign that doctors look for. It's known as the hand of benediction, and you can spot it when you ask someone to do something really simple.
Here's the key. If you ask someone with a high median nerve injury to make a fist, they can't do it properly. The nerve supply to the muscles that curl your index and middle fingers has been knocked out. But, and this is the interesting part, the muscles that bend your ring and little fingers are powered by a completely different nerve, the ulnar nerve. So those fingers still work just fine. The result is this very characteristic shape with two fingers stuck pointing out. The median nerve is just a perfect example of the intricate and kind of vulnerable wiring that powers all of us. Its journey and its jobs are a powerful reminder to listen to the signals our body send, whether that's a little tingle in our fingertips or a weakness in our grip. So I guess the real question is, what is your nervous system telling you? Thanks for tuning in.